The world is in uncharted territory when it comes to the coronavirus outbreak. That's according to the World Health Organization, which has reported infections in at least 73 countries. The number of deaths and confirmed cases are growing by the hundreds in some nations in the world. Are we facing a global pandemic? To help us delve deeper into the issue, we have joining today Dr. Stanley Perlman, who has been studying coronaviruses like COVID-19 for the last 38 years. To my left, we have Dr. Benjamin Cowling from Hong Kong University, an expert on the transmission patterns of respiratory diseases.
Good morning.
Good morning. Now, first of all, before we start asking you the questions that we've prepared, COVID-19 has infected more than 94,000 people and killed over 3,200 people worldwide. But the WHO is still reluctant to actually call it a pandemic. So, well, let's first take a listen to what the WHO's Health Emergencies Executive Director Michael Ryan had to say recently.
We're essentially accepting that every human on the planet will be exposed to that virus. To accept that mitigation is the only option, is to accept that the virus cannot be stopped. And we've seen evidence from China that this virus can be significantly curbed in its spread.
Well, despite that, we're seeing a soaring number of infections every day across unsuspecting communities and countries that thought they were relatively safe. So, Dr. Perlman, would you call the COVID-19 outbreak a pandemic now?
I would. My definition would be being a pandemic, but it's one of those things I'd rather have the WHO call it, because that's their job and they know best. So it certainly is spreading to lots of countries. Lots of people are being infected within those countries, and there's human-to-human spread. So when it crosses the line to pandemic, I would have the WHO decide.
Well, what about you, Dr. Cowling? Would you agree with the WHO? Do you consider this a pandemic? I mean, what is a pandemic, really?
Yeah, I agree with Dr. Perlman's comment as well. We've seen sustained transmission in multiple continents around the world. There's no sign that there's suddenly going to be a stop in transmission. It's going to be very difficult to stop transmission in some parts of the world that are now affected. So I think, it is time to think about this as a pandemic.
Well, the WHO has expressed hope that this virus is still containable, but that's also quite questionable among some experts. And really, recently the head of the WHO actually lauded China's lockdown of entire communities and cities to contain the virus. But Dr. Perlman, would you say that this approach is really effective?
Well, I don't know if I'd call it totally effective. I think it slows down the spread of the virus. We don't know the dynamics of this virus, though, so we don't know if we slow it down now, as it means that it'll come back in the fall with more cases because we've slowed it down now. Have things gotten better, and will we develop a vaccine or a therapy that would be helpful, so the delay will be useful? I think these are things we would love to know, but we really don't know yet. And I think in China that a lot of people were kept in their homes in several of these places. And that's going to slow the spread of virus if people are not around each other. But what its effect long-term will be, I think, is an open question.
Right, I see. What about you, Dr. Cowling? Do you think, locking down entire communities is an effective approach that could be maybe replicated in other countries?
I think there's got to be a balance between protecting people's health and also protecting people's livelihoods. So for sure, we could stop anyone from transmitting infection to anyone else by asking everyone to stay in their homes for weeks on end, but that's going to have a serious economic knock-on effect. So I think we got to think more carefully about sustainable ways to prevent or to slow down transmission that don't require the same kind of lockdowns that were used as a reasonable emergency measure, given there was a lot of uncertainty about what was happening. And they have bought time, not only for China, but for the rest of the world. But now's really the time to use that delay effectively to prepare better for what may well be coming in the next month or two.
Right, I see. And well, the WHO says that COVID-19 is likely to kill 3.4% of those affected. But can we actually trust that number, though, when we don't even know just how many people have been affected to actually determine the denominator?
Yeah,
Well,
so do you want me to answer that?
sure,
first?
let's
Yeah.
go with you first, Dr. Perlman.
Yeah, so I think that, as you said, I don't think we know the denominator yet. And I think that the death rate in Korea is much lower than the one in Italy right now, which may mean that there's many more cases in Italy that we don't know about. And so I think that we don't know how many people have mild infection. We know that the virus seems to pop up in places we don't expect it to. So it says to me that there's people who have the infection, maybe have mild infection, but are spreading it to other people who eventually spread it to the person who becomes the sentinel person who shows clinical disease. So yes, we expect it to go down. But, again, like so many other things about this disease, we don't know for sure what's going on yet.
Well, it does seem like we have still a lot of uncertainties, but amid all this, China has said that it's actually winning the battle against the coronavirus, and the WHO has, of course, held its progress. But what dangers do we face by possibly taking this new coronavirus maybe a bit too lightly? Dr. Cowling, could you help us with that?
Yeah, I think it's fair to say that China's contained the first wave of their epidemic, but the question now is, will there be a second wave? How quickly may that happen? And what would the response be to a second wave? Because I don't think the same measures can be used again to the extent that they were used to contain the first wave. I don't think many affected countries are taking it lightly now, having seen what's happened in Italy, what's happened in Iran, and indeed in Korea. The question is really each country is going to have to figure out the right way to respond to it, and the measures that are possible. We've seen Italy just decide to close schools. That won't be possible in every place, and we don't know to what extent children are driving transmission. But I think any measure that's taken like that will have some effect, and most likely we need to look at multiple types of measures to really combine the effects together and reduce transmission as much as we can.
Right, and with its soaring number of infection cases and deaths, really, South Korea has been rolling out emergency measures to test thousands of people every day and also help those infected get the support they need. Dr. Perlman, how do you think the country's doing so far?
I think that with the mortality rate that was mentioned in the news earlier, I think that Korea is probably doing as well as anybody else, if not better. They're being very careful, identifying infected patients, tracing back contacts, isolating people who need isolation, but not shutting down whole cities. So I think that South Korea should be lauded for the progress it's making. Of course, we all hope this will go away very quickly, but right now I think that it's doing the right countermeasures.
Right, and how about you, Dr. Cowling? From Hong Kong, how do you see this, this case being handled in South Korea?
Yeah, I'm really impressed by the amount of laboratory testing that you're able to do. 10,000 people tested in a day is remarkable, and that's probably the most in any country outside China. The question, though, for me is how is South Korea going to reduce transmission in the community? Because detecting cases is important, isolating cases is important, giving them proper treatment, but we also need to think about community measures like social distancing to keep people apart more, so encouraging people to work at home, cancelling mass gatherings, and those kind of measures to really slow down transmission. Otherwise, within the next few weeks, we're going to see steady increases in the numbers, and that there's going to be a lot more people getting sick and then seeking healthcare, and that's really the danger in a pandemic like this. How do you cope with a surge in people that need to have healthcare?
I see. Well, I'm afraid this is where we'll have to end our discussion today. Dr. Stanley Perlman, thank you for joining us all the way from Iowa in the States, and Dr. Ben Cowling from the University of Hong Kong. Thank you both for joining us.
You're very welcome.
Yeah, nice to see you. Bye-bye.
Thank you. Well, that wraps up our show today as well. Thank you to our viewers from around the world. Do join us again at the same time tomorrow for more insights on issues making headlines. Goodbye.